This afternoon, my goal, me and Marion, is to talk to you about the Advocacy Toolkit. So this morning, briefly, we talked, somebody asked about, how can we be more involved? How can we have this coming to our community, get the word out, start the conversation, have women be more aware of women's and heart health and, how different they are from men when it comes to heart disease. So hopefully within the next 40 minutes or so, we'll be able to give you more information about how each one of you could be involved in getting the word out and becoming an advocate for women's heart health. So we'll cover with you the Advocacy Toolkit, explain to you a little bit like the need, why did we put that toolkit together, how it works, the eligibility criteria, so who could be involved, which is pretty much anybody, training curriculum in order to become an advocate and use the Advocacy Toolkit, and then we'll talk about the toolkit component. We'll go a little bit more in depth into the toolkit component to really get you to see, if you decide to take that option on and become an advocate, what would be the presentation that you would use within the community to get the word out. So that will be the bulk of the presentation today. Any questions so far? Perfect. So why did we create the Advocacy Toolkit? Because we want the word to go out into the community. We want women to become more advocate for themselves, feel more empowered that they have a role to play when it comes to their own heart health. We know from what you've been hearing all along today, and that's why this presentation is a nice kind of wrap up to the day, women are underestimated, underdiagnosed. Their risk when it comes to their diagnosis and the tools that we have, they're also under research. So we want to make sure that we are educating women to increase that willingness to become, for them to take action to protect themselves and become advocates. So what is advocacy? We keep talking about this big word of advocacy. What is advocacy? So advocacy basically is transforming the public attitude through education. So increasing that awareness, empowering the women, giving them the tools that they need in order for them to be able to support themselves, support other individuals, other women within the community locally. So how does the Advocacy Toolkit work? So step one, you would register online at yourheart.ca, always in the same spot. Yourheart.ca will allow you to register to become an advocate, so you'll have to create an account for yourself with your username and password. And after that, you will get access to the training. So once you're registered, we'll send you off an email that will give you access to the training course that will take you about 2 to 3 hours to complete. It's all done online. And once the training is complete, then you get access to the toolkit. So that will give you access to the speaker notes, to the resources, to the presentation that you'll see today, to the different infographics that you could use for your presentation. So all that is protected in a password protected area, and you'll get access to all that once you complete your training. Who's eligible? So it could be women at risk for heart disease. So you don't necessarily have to have had heart disease in order to become an advocate within the community. It could be women who are at risk for heart disease, women who has a diagnosis for heart disease, any member, any family member or caregivers of women who have had heart disease, or simply a passionate person that would like to advocate for the cause and increase the awareness when it comes to women's heart health. So that could be your physician, your pharmacist, anybody within your local community could have access to that presentation and training and start getting the word and starting the conversation. So the course, the training curriculum have 5 different modules. So when you go online, there will be 5 different modules to that toolkit. So we'll review the Advocacy Toolkit overview, so you'll get to see what it's all about. We'll teach you about sharing your story to have a greatest impact on those who you're presenting to. Presentation skills 101. Women's heart health presentation, so we'll talk about because her heart matters, and that's the information, once again, that you'll see just a little bit later on. And how to plan, so we'll teach you also through that training, through the modules, how to plan for organizing community presentations. So sometimes you might already have, certain people within your network that would be interested in organizing such a presentation, but if not, and you would like to be presenting, we'll teach you how to go out and like talk to people and, promote the cause and be able to organize some presentations. So there will be, as you go through the module, some knowledge test. And also a certification, but it's not like a one time where you have to pass or you fail. You could do it over and over till you pass the test, and then you will get your certification and go from there. So no stress there. It's, you'll have plenty of time and plenty of chance. And also the way the modules work is that it doesn't have to be all in one sitting that you have to go through the whole thing. You could be in and out of it and do it at your own pace. So what's included into the toolkit? So there is 4 different components. So the presentation itself. So at that point, you don't have to develop anything. You don't have to worry about, putting the slides together. It's all done for you with the speaker notes at the bottom, as you can see here. So it's pretty much just getting to know that material and be able to present it. So the 5 key components of the presentation is describing what is heart disease, describing heart disease differences in women versus men, talking about their different risk factors, knowing how to take control of your health, and key messages. There's also the second part that you will have access to is the handouts and all the resources that goes along. So you've seen some of those infographics already today on our resource table. You will have access to these to be able to give them out in your talks. You will have questions to ask your doctor. So there's a whole section, because often that's a big topic that comes out. How do I ask my doctor? How do I talk to my doctor? So there is a handout developed on that. And also a Heart Healthy Story video series that you will have access to that you could use part of your presentation. We give you access to the forms that you might need. The only thing that we ask you as an advocate is to help us to keep track of how many of those presentations we're doing. So in terms of reporting back to us, your only duty will be really to excuse me, letting us know how many presentation you're doing, how many people are showing up to each one of your presentation, and if there's any evaluations that you receive back, to provide us with that so we continuously keep improving. And these are all forms that are already developed, and you will have access to them as part of the kit. And then the last part is if you're creating any events and you need posters, you already have the templates available, email template to contact different people to be able to set up some of the presentation. All of those things are already existent for you. So that's in a nutshell in terms of what is the advocacy toolkit, what you get access to. From this point on, we'll go a little bit more in depth of the presentation itself, so you get a feel of it, of what is that material that you could be presenting when you're doing the advocacy toolkit. And for that, I'll invite Marion to come and walk you through, as being one of our greatest advocates, like Carrie mentioned.
Great, thank you, and welcome everybody. Hope everybody's having a great day, learning lots like I am all the time. So what I'm going to talk to you about is sort of run through what the advocacy toolkit is like when you're out in the community presenting this program to the community, and the people in your community. So what I'm going to talk to you about is what is, is a woman's heart really that different? And what are some of the signs and symptoms that a woman can present with? And we've talked a lot about this information I'm going to provide to you. We've already covered it today, so some of it might be a little bit repetitive.
Who is she? She's been by your side your whole life. She watched over you. She laughed with you, cried with you. She kissed you. She filled your heart when it was empty, and she lived to protect it. But who's protecting hers? Who was there for the Canadian women who died last year? Who warned them about a disease that's killing more women than all cancers, tuberculosis, HIV/AIDS, and malaria combined? Who's shouting women are more likely to die from it than men? Who's telling them it's not just those who have it, it's our families, our friends, our mothers, our daughters, sisters, aunts? It's you. Every woman is at risk. Who is going to protect the 5 million women around the world it is estimated to kill next year? You will. Her heart is in your hands. Find the causes. Know the symptoms. understand how to protect it, take care of it. Start talking, start shouting, start the conversation so she can keep holding, keep loving, and keep protecting our hearts. Because in this moment, we choose to protect hers.
When I was first shown that video, this was a few years ago. I think actually Lisa might have brought that video to my attention. I was sitting in the back room, so I found it very emotional, learning more and more about women's heart health. On the screen right now are some important facts about heart disease in women. I'm not going to go through them all, but at one time we thought heart disease was a man's disease, where in actual fact, 1 in 3 women will suffer from a heart event at some point in time in their life. Also, only about 13% of Canadian women can identify heart disease as their greatest health risk. So it's quite astounding that we need to learn more about our own heart health, plus we need to get our family physicians to learn more about how heart disease presents in women as well. I was just speaking to a woman this morning, actually just this afternoon, and I was saying, we're seeing an increase in heart disease in younger women. And what I'm also noticing, it's due mainly sometimes to our risk factors and also to maybe our poor healthy lifestyle. And also when you ask a woman what is her perception of heart disease once she's been diagnosed and treated, well, 2/3 of us realize, we now have a chronic condition, a chronic disease, and we have to manage our risk factors for the rest of our life. But one of the women in my Women at Heart peer support program, she fell within the 1/3 category when we started talking about heart disease. She felt this is a one-time event, a one-time episode. I can just go back to my pre-diagnosed lifestyle. She didn't realize that she now had a chronic condition, a chronic disease she had to manage for the rest of her life. So when we look at a man's heart and a female's heart, overall, they look the same. And most of our doctors are taught that a man's heart and a woman's heart basically looks the same, that it's a muscle. Where in actual fact, a woman's heart is smaller. Our hearts are about 2/3 the size of that of a man. Our hearts beat faster. Our coronary arteries are smaller. And the way the plaque builds up in our coronary arteries is different in a woman as compared to a man. In a woman, the coronary arteries, a plaque will build up more smoothly, more evenly along the walls of the coronary arteries, whereas a man, the way the plaque builds up is more irregular and bulky. And as also for women, we often go through many hormonal changes throughout our lifespan, from pregnancy to menopause, and unfortunately that does have an effect on our heart. So as a result, some risk factors are unique to each man and to women. So when it comes to heart disease in women, we are under-researched, under-diagnosed, we're under-treated, and we're under-aware. Even though, as women, we make up over half the population, but really 70% of what we know today about cardiovascular disease is the result of research conducted on men. So the strategies we have out there to identify heart disease and to treat heart disease is a result of data that has been collected primarily on middle-aged white men. So as a result, we know that our clinical guidelines results in research evidence. So then most of the medical decisions for us women is based on how heart disease is manifested in men. Also, there is a lack of participation on our behalf to do research, and often we can't find women that are willing to participate in research. And also, because of our roles and our responsibilities and our other facets of life, often we don't take the time to think about participating in research. But there's some positive changes coming down, which I'm really pleased to hear about, because some of the agencies now that are funding our research, they're now recommending that women do have to participate in research. And if they cannot get enough women to participate in this research, then they need to know why the women are not before they actually give out the funding. Also, women are underdiagnosed because as us, women, as well as our healthcare providers, we're often slow to identify the signs and symptoms that we could be presenting with a heart attack. Sometimes these signs and symptoms go unrecognized, sometimes they're overlooked, not only by us, but also by our healthcare provider. And I think we heard this stat this morning that early signs of heart attack are often missed in 78% of women. And sometimes that misdiagnosis we see more commonly in younger women, and sometimes the result is that a woman just has not reported these signs and symptoms that she's experiencing. Also, maybe the physician will look for other causes of the symptoms that this woman is presenting with. And what happens then, possibly they will not order the appropriate testing to rule out cardiac issues. See if I have forgotten anything. Let's see. I think that's about all of that. When we get into another reason why women also are undiagnosed, and it's right there on the slide, is that often, we delay in seeking help, and the reason being is we're afraid of what the doctor's going to tell us. Okay? What if he tells me that, okay, I have to be admitted or something's really wrong? But possibly we don't want to hear that. How often have we said to ourselves, I'm embarrassed. What if I go to the doctor, see the doctor, and actually the doctor says there's nothing wrong with you? So we're embarrassed as women to possibly present our symptoms to the doctor. I'm seeing more and more women living alone. And if you're living alone, guess what? We often don't tell our family, friends that, I'm not feeling well, that I have these symptoms, and we don't talk about them. How often have we said, we don't want to bother anybody? I'll just suffer in silence. We don't talk about it. And sometimes as ourselves, we just misinterpret what the signs and symptoms are that we are experiencing. So we know this, as we said this morning, every minute does count because it's really critical to survival and to minimize any damage on our heart. Also underdiagnosed, and we talked about these symptoms earlier today, so I'm not really going to go through them in detail, but when we're doing a talk in the community, I do talk about the signs and symptoms that a woman can experience when she presents with a heart attack. And we talked today about a typical heart attack where it's the classic sort of Hollywood-type heart attack where a person clutches their chest due to crushing chest pain. Often women don't experience those typical experiences of chest pain, of symptoms. So we often have different symptoms and signs presenting with heart disease. So they're up there on the screen. I'm not going to go through all of them. Just remember, most times with a heart attack, women and men do present with some sort of chest discomfort, some sort of chest pain. But sometimes, as Dr. Katina said this morning, we often might experience 3 to 4 other signs and symptoms as well besides just chest pain. The key thing, younger women sometimes are overlooked because the doctor might think, maybe it's stress, maybe it's anxiety, maybe it's indigestion, maybe it's female issues, and sometimes they delay in seeking and getting the proper treatment and diagnosis. So you've got common symptoms there, and you've got some uncommon symptoms as well. Just remember that not everybody will present the same, and the key thing is, you really need to seek help if you are experiencing any of these symptoms. Just don't suffer in silence. As I mentioned, women are undertreated because in the last 10 years there's been a lot of evidence of sex disparities. And we just mentioned a minute ago, the risk of heart disease in women, unfortunately, is often underestimated. And as a result, there's a notable difference in how heart disease is identified in women as compared to men, also the treatment that women receive, and unfortunately, our outcome. And the reason that this is due is there's still a lack of public, which is us, as well as professional awareness of women's coronary risk factors. Also, as I just mentioned, there's still a knowledge gap in the signs and symptoms that women experience when they're presenting with a heart attack, and still today we have optimal screening and diagnostic procedures for women. So as a result of this, women have an adverse coronary outcome. So unfortunately today, still women are understudied, we're underdiagnosed, and we're undertreated, leading to multiple sex disparities. Also, women were underaware. In 2014, a Canadian survey was conducted on over 1,600 women. And what they wanted to find out in this survey, what was a woman's perceived knowledge versus what was her actual knowledge when it came to knowing her risk of developing heart disease. But they also wanted to find out what was a woman's awareness of heart disease and heart health, what was her knowledge related to heart disease and heart health. They also wanted to find out what the woman's attitude was related to heart disease and heart health, what was her beliefs, her perception when it came to heart disease and heart health. And they also wanted to find out if a woman was motivated to seek health information and care, or did she have any barriers preventing her from seeking health information and care, or did she have a preference when it came to seeking health information and care. So as a result of this survey, it was realized there is a substantial gap between a woman's perceived knowledge versus her actual knowledge when it comes to knowing the signs and symptoms that she could be presenting with a heart attack, also to knowing the risk factors for heart disease, and notably the risk factors of high blood pressure, high cholesterol, diabetes, and smoking. So in order to analyze this survey, a scoring index was created having 0 at the bottom end, 40 at the upper end. And you can see from the slide, the overall mean from this survey was 15, which is quite modest. It was less than half. But it was interesting, 60% of the women in the survey were already at higher risk of developing heart disease due to medical risk factors. They thought their risk was low to moderate of developing heart disease. And 80% of the women in this survey also had a low knowledge score. These women actually perceived they were very well informed about heart disease. So what's alarming about this is that actually it's very critical because women who already have cardiovascular disease or who are at high risk of developing cardiovascular disease can fall within these categories. And that's your slide. So Nadine's going to talk to you about some of the risk factors.
So part of the presentation as well is to be able to provide information to your participants, and I'm kind of relating it back to you the way you might be presenting if ever you decide to become an advocate. So we want to talk to them about the factors, we want to talk to them about the information and how heart disease is different, but we want to make sure to also show them that there is a light at the end of the tunnel and there's a lot of things that they could do themselves in terms of improving their heart health. So now we're going to take a quick look at about what are the risk factors for heart disease and how can we actually take actions to improve. So first question to ask, are you at risk for heart disease? Like Marion was just saying, a lot of women won't realize that they actually are at risk, or they might treat their heart event as a one-time episode and they're fixed and they're good to go. But when it comes to risk do start as young as the age of 20. So we want to make sure that, we create good habits to begin with to help reduce our risk over our lifespan in terms of healthy eating and physical activity. We also want to make sure that we know our family history, and Natalie this morning in her presentation, for those of you who were here, did talk a little bit more about the family history and how important it is to know, because it does double our own risk for heart disease if we had any family member that had heart disease at a younger age. So it's always important to encourage, to ask and to know, who in their family had event in order to reduce that risk as well. Complications also increase when it comes to, pregnancy, like hormonal changes when it comes to women. So if you develop preeclampsia, hypertension during your pregnancy, or gestational diabetes during the pregnancy, now we know that that's an equivalent for being at high risk for heart disease later on in life. So these are factors also that early on we need to be aware of and to increase the word out so younger women know about that. And in terms of, post-menopause, when it comes to having menopause early on, that will increase our chances by 50% as well in terms of developing heart disease. And when our cholesterol levels also will start worsening once we hit that phase of menopause and after menopause. So these are things that, we don't often talk about, women are not aware of, to consider as they look about, the risk for heart disease over a lifespan, and not just when they have their actual event or their condition diagnosed. So why is it important to think about primary prevention? So reducing risk factors before having your first event or before having a first diagnosis will reduce by 33% of all deaths. And when it comes to secondary prevention, after having a heart event, it could also reduce mortality by 25%. So that's why, whether it's primary prevention prior to having an event or secondary prevention in terms of using your new diagnosis and making sure that you continue to make changes to your lifestyle to reduce your risk, they're both as important. So you should never look at it as being a one-time thing that I don't have to worry about, but there is that prevention and secondary prevention that is important to keep reducing our risk. So we already covered the risk factors this morning in terms of the one that we can change and the one that we cannot change. So age, sex, ethnicity, and family history are the non-modifiable risk factors. So these are the ones that we can't do anything about but are important to be aware of. And the good news is that there's 80% of our risk factors that we could actually make changes to in order to improve our heart health. So things like knowing our numbers when it comes to blood pressure, cholesterol, diabetes. So these are our clinical risk factors. And in terms of looking on our behavior, we have the psychosocial factor like stress, anxiety, smoking, overweight, physical inactivity, and healthy eating habit. These are all things that we could do in terms of changing our behavior to reduce our overall risk. So it's important to know the numbers, like we said this morning, and talking to your physician, and never just taking it's all good or your numbers are good, but really knowing the numbers and knowing what to compare them to based on the guidelines that Natalie presented this morning. So when it comes to risk factors, so keeping in mind that every time you add a risk factor to yourself, like in terms of not having any risk factor, you're only 2 times at risk. But if you add 1 more risk factor, you go up 2 risk factors, then you become more at risk for heart disease, 6 times more for heart disease. And if you have 3 or more risk factors, you become 10 times more at risk for heart disease. And that's why it's important to watch out on the modifiable risk factor, because you don't want to have 3, you don't want to have 2, but you try to keep always your numbers within range to have a minimum risk. Because as you add the numbers of risk factors you had, you're increasing your chances of developing a heart event. So, know, understand, and act. So the reason why we provide, the women you'll be presenting to, or that we provide that information, is to increase that awareness. Because just having awareness is not enough in order to make change, but it's important to personalize that information and see what it means to them. So that's where the know your number come in important. And then that will help us in terms of making changes, taking action, and improving our overall cardiovascular health. So it's important to know the numbers in order to be able to take some action. So what kind of action can we take in order to improve our heart health? So it's never too late. Knowing that it's never too late to make a change, that's the first message that we want to make sure that we're leaving people with. If you have any risk factor, whether 1, 2, or 3, start taking any action in order to manage them and reduce the number of risk factors that you have. Take it one step at a time. So when you know that you have multiple risk factors, you're not going to be able to change all of them at once, but it's one at a time. So small change will add up. Sometimes a small change at that time doesn't seem like it will make a huge difference, but when you add every small change you do, then you're able to set realistic goals and actually achieve a change at the end. And reward yourself for your success as you keep moving along. So these would be kind of the 3 key things that you want to leave people with in terms of helping them make change. We have our top 10 tips for healthy eating, exercise, stress, and emotional health, and you have them available outside at the resource table. And these would be the type of resources that as an advocate you would get access to in order to give out at your presentation, and also to elaborate on as you go through them. So we've covered a lot of them throughout the day. I won't go through in detail, but these would be the key resources that you're leaving people with in terms of start those small changing steps that we talked about. Same thing with emotional health and managing stress. So a perfect one that you've done earlier today is the meditation. That would be one of the things that could be done in order to help with emotional health. And then I'll pass it over to Marion for the final touch.
Thank you. So I just want to leave you with a few key messages from today. And again, if you have any questions, we're certainly here to answer those questions for you. It's really important that we do start the conversation. We do need to speak not only to our family members, but also our physicians, people out there about women's heart health. We've heard a lot of information today and a lot of stats, a lot of facts about women's heart health. So it's really important that we do get out there and start the conversation about women's heart health, because there's a real need to increase the awareness. Because as women, we need to recognize that we are at a significant risk of developing heart disease. So it's important that, if we have a low level of heart health knowledge combined with unhealthy behaviors, unfortunately that is putting us at a great risk of heart disease. As I mentioned earlier, we need to have more women volunteer for research, because we really need to find out better how and understand how heart disease is different in women as compared to men. And because of this new research that hopefully we will gain, we'll put new evidence from the research and we'll be able to put it into clinical practice. Also, please don't wait. If you're in doubt, please check it out. Time is of the essence, and if you feel that you're having any symptoms related to a heart issue, cardiac symptoms, or a heart attack, it's important to please call 911 and to seek immediate help. I've talked to other women and I said, you need to call the ambulance now because you are symptomatic. Well, I don't want to bother them. Please don't do that. Please seek help. And also demand that cardiac issues be ruled out first. As I mentioned earlier, sometimes our physicians think our symptoms that we're experiencing are related to another cause. So sometimes they don't order the appropriate tests to rule out cardiac issues first. So please take a moment and really demand that cardiac issues be ruled out. And as we've heard many times today, that heart disease is the #1 killer of women worldwide, and it does now affect women of all ages right across our lifespan. So it is a now problem. It's something we have to really take hold and know more and more about it now, because it is a now problem. And then we've heard different times today that heart disease really is largely preventable, because 80% of those risk factors that are within our control, if we're managing those risk factors, it can largely prevent heart disease from occurring. So it's really important that we look after our health. Be our own advocate. We've heard this word before. Seek out as much information as possible about your condition. Ask many, many questions. Also, if you're going to the doctor, you might want to take somebody with you to take notes. Also, if you're going to the doctor, make sure you write down a list of the important things you want to discuss with your doctor, because you need to get as much information as possible about your care. And when you're talking to your doctor, you want to ask, what is my current health status? What is going on with me? Also, find out what can you do to improve it. So can you get an action plan between yourself and your healthcare provider to work effectively to help with your condition? Because when women are valued and when we're well, our families, our children, and our communities benefit. So this is sort of an overall view. This is also about the community advocacy, because basically with this toolkit, you're able to go out into the community, be a strong advocate for women's heart health. And it doesn't just have to be women that are giving the program. It could be a caregiver, and that caregiver could be a man. So it's really important that we become strong advocates, getting out into the community, getting our message across that we all need to know more about our women's heart health. And also, we've talked many times about the website, yourheart.ca. I refer to the website many, many times. That's the Canadian Women's Heart Health website. Please share that website with your family members and also with your healthcare provider. There's lots of information on there about signs and symptoms that we could have presenting with a heart attack. We talk about the different risk factors. They're on there as well. All the valuable programs that the Heart Institute and the Canadian Women's Heart Health Centre have developed are on that website. So there might be a program on that website that's offered by the Canadian Women's Heart Health Centre that you might want to get involved with. And this is one of them as well. Anyway, thank you very much for your time. Thanks for attending Wear Red Canada. This is the second annual Wear Red Canada, so we really appreciate the red that we see in the audience, but we're here to take any questions if you have any questions.